Yeah, so the first question is, how does dysbiosis specifically affect women across different life stages like PCOS, pregnancy, and menopause?
So, what is the microbiome? It is a collection of microorganisms. It is a collection of microorganisms like bacteria, viruses, fungus, and other organisms. And these, when they exist within our body or in our environment, it's called a microbiome. And these bacteria can be friendly and they can be unfriendly or disease producing, and the friendly ones are health producing. Now, every individual has a different microbiome. It's almost like a signature. And when the unfriendly or the disease producing organisms become more than the friendly ones, it causes disease. So it affects women in different stages of life in different ways. Women who are premenopausal, that means young women in the reproductive age group, it can cause a hormonal imbalance due to change in their metabolism. And that can result in a very well known condition called polycystic ovarian syndrome. Besides that, it can also lead to conditions like endometriosis, fibroids, and additionally obesity, and so on and so forth. Now, in pregnancy, would you want me to talk about pregnancy or something else?
No, we can talk about it. I think once you're done, we can have other doctors
Okay.
also put forward
Right.
their.
So pregnancy is a condition where hormonal levels really change. And in case there is dysbiosis in pregnancy, these changes can lead to infections, which then can cause premature labor. It can even cause gestational diabetes. So, in pregnancy, it is very important to take care of the microbiome in different ways. And then we come to the last stage, the last but not the least, which is menopause, where the hormonal levels dip. So the estrogen and the progesterone really dip. And that causes changes in the vaginal pH, and where dysbiosis can happen and cause vaginal infections, urinary infections, as well as vaginal dryness. Besides, it is also related to the brain. The, our microbiome and our brain is also connected. So it can cause dementia, increase Alzheimer's disease, brain fog, depression, and so on and so forth.
Right, doctor, would you like to add something to that?
See, Madam has already enumerated most of the things actually. So, for a common person to understand what it is, I will tell you an example, simple example. See, as Madam correctly told, in the gut there is a balance. See, microbiomes is more important in gut, vagina, and skin. Okay, that influences metabolism, immune system, defense, everything it influences. To make it simple, I will give you an example. In our intestine, imagine that it's a balance between the good microbes and the bad microbes. Okay, patient is having some infection somewhere, and that person is taking antibiotics. You imagine that person is taking antibiotics. Antibiotics is, for example, maybe a lung infection, not the gut infection. Antibiotics is being taken. So what happens is that it's an oral antibiotic that is taken. It will destroy the good microbes inside the intestine. So what happens is that the bad microbes increases. Okay. So that is what comes as antibiotic induced diarrhea. So you understood this is what is you mean by dysbiosis, a classical example. What happens in PCOS is a theory what has come. It's a theory that is the most important theory. It's called the dogma theory, which has come. Dysbiosis of gut microbiota. Basically, we all know that lifestyle changes is the most important in PCOS. So what happens in PCOS is that imagine that adolescent girls goes and takes high fatty foods, high sugar, all junk foods, everything is taken. So it will destroy her microbiota, which is useful, and destroy the epithelium. So it causes something called a leaky gut syndrome. The epithelium is damaged, so the bacterial toxins can cross and it can secrete lipopolysaccharides. Basically what happens is that this generates insulin resistance in the body. So, and that is the reason for, you all know what are the features which has comes in PCOS basically. That is why in PCOS they say that this healthy lifestyle and food habits are very important. Same thing. I'm just adding examples to what Madam told. I don't want to explain what she told. In pregnancy, what happens, or in adolescent, what happens? We have lactobacillus, which is protective in the vagina. We all know when the estrogen influence, the lactobacillus secretes lactic acid and changes the vaginal pH to acidic. So that is the protective part. Once this microbiome atmosphere or dysbiosis occurs in the vagina, the lactobacillus comes down. So in an adolescent age group or in a postmenopausal age group where the estrogen is less, what happens is that the chance of infection is small. So what happens in pregnancy? Imagine, see what is the infections like bacterial vaginosis increases. So when you take a patient with vaginal SAP with bacterial and Nugent score or whatever score you see, you can see that the lactobacillus levels are less. So when the lactobacillus levels are less, the infections occur that lead to preterm labor, premature rupture of membrane, and the same principle what I told, the GDM occurs with the same principle what I told with the gut bacterium. So the gut microbiome and the vaginal microbiome are interrelated. Okay, interrelated. All these are interrelated. So these are the basics. So we understood what is an adolescent, menopause. I just added some examples to make you understand what is dysbiosis. Okay, this is what happens. That's
I would additionally like to add that these days a lot of young girls coming to the clinic, so they read a lot about something known as leukorrhea over the internet or in the text, and the healthy vaginal discharge is sometimes being taken up as an unhealthy vaginal discharge. And what these girls are doing is they are taking these over-the-counter available vaginal pills to treat normal vaginal discharge, and in effect causing vaginal dysbiosis by killing the normal healthy bacteria in your vagina. Also these douches, there are women who are using various chemicals to clean their vagina. We all should know that vagina is self-cleansing. Vagina cleans itself, so women shouldn't be using douches or Savlon solutions or betadine pessaries to keep their vagina clean. So by the use of these harmful pessaries and douches, what is happening is that the normal microbiome of the vagina is getting damaged, and as sir already mentioned, then the harmful bacterial levels go up, and then the colonization happens. And by the time these girls come to our clinics, they are already suffering from almost intractable infections, because some unhealthy practices or lack of knowledge has resulted in them killing their useful vaginal microbiome actually.
Dr.
Because
Kiran.
of this, many of the girls, they come with recurrent UTIs too, because they are using different kinds of douches, creams, without like over the counter, even probiotics also they are using. But I'd like to focus on what should we do to prevent. How should we like diagnose dysbiosis at an early stage? Ma'am, do we have any suggestions regarding this?
Diagnosing it
Diagnosing
at an early
dysbiosis
stage.
at an early stage.
Well, first of all, like she said that this over cleanliness is a cause of dysbiosis. So the message that should go across is that too much cleanliness, because patients come, girls come and they say, but I'm very hygienic, I scrub and clean all the time. So what should be told to them is that actually this over cleanliness is what is causing your problems. Over sanitation is killing the friendly bacteria and leading to the unfriendly bacteria, disease causing bacteria to grow more.
And most of the times without adequate testing, multiple prescription of antibiotics, antifungals, women will have at least, they would have taken 10-12 courses of antibiotics from different practitioners. They would insist that there is some discharge which needs to be treated, and a lot of people would be giving them treatments without a proper examination, sometimes proper evaluation, proper investigation, and we may sometimes end up treating normal vaginal discharge and then killing the vaginal microbiome. and also the gut microbiome in
Right.
principle, leading to a plethora of problems.
So I think you
Do
asked
you
me the
have-
question how to diagnose it
Yeah,
early.
yeah.
Yes.
Actually, we are talking at the age of adolescent age and women's reproductive age, menopause. Actually, the symbiosis starts at birth. Through vagina, while passing through vagina, only the baby the bacteria from the mother's microbiome, vaginal microbiome, the microbiome establishes at birth. These days, cesarean section rate has increased so much. Yeah, the children are not exposed to my mother's vaginal microbiome. There only the dysbiosis started actually, and moreover, and the lifestyle, dietary habits, everything all added on it, and the dysbiosis started, and the increasing incidence of PCOS and reproductive problems, everything else has gone up. So like, I would say like that.
Right, so we were talking about detection of...
Detection,
Yeah.
see, when see, it's not as easy as what we think. See, we can do the lactobacillus specific detection techniques, like you can see the vaginal swab, you can take a stool sample and look for the specific, you can look for. But when you go after specific, how do you test it? Okay, so this is where something like a DNA sequencing, gene sequencing comes into matter. It can be, you can do like complete genomic sequence of all the bacteria, or you can go for specific. Or instead of doing the genomic sequencing, you can go for the metabolic products produced by the bacteria. See, two ways you can detect metabolic products produced by the bacteria. See, simple. In that, if you say short chain fatty acids,
Some biogenic
bile acids, all this. See, biomes. See, what is the products of? Or you can directly go and detect the genomic study. You can go for detecting the genomic study. These are the two ways of doing it. And you can see the number of levels of lactobacillus stool, I said. So there are three ways of detecting, early detecting. The problem of early detecting is all these things are very costly. So very costly affair to do all these things.
I think one of the simplest ways is when a girl or a woman complaining of vaginal infection comes, the best thing to do is to do a Nugent score, where you just take out the discharge and get it tested to see how many lactobacilli, how many bacteria. So there is a certain score, and if the lactobacilli are less, then you know that this is dysbiosis.
That is what the simplest, but it doesn't give, they say that the exact.
However, yes.
No, I would like to know how much does it cost? Like we're talking about
This
the
is
cost.
what I said is a very simple kind of a test and can be done in any village doctor who is basically trained and has a microscope. So that is, but of course, like Dr. Ashwath says, it doesn't tell us. However, we know what are the friendly bacteria in the vagina.
Only thing what we can do by Nugent score is that we know that there is lack of bacteria, less is there. So you may have to add probiotics or whatever you want to add. You can add to it. That is what comes. But as this, our question comes is that as these tests are all the tests which I mentioned are all very costly tests. The question comes here is that should we give it without prophylactically, should we give probiotics? That is the question, the $1 million question that is coming. That is what, should we prescribe probiotics to people of a vulnerable group of patients? We should give probiotics prophylactically or not?
Not only
There are
cost,
so
the
many
accessibility of the
over-the-counter
test.
probiotics are available. So very
And-
difficult to choose
Yeah.
which probiotics to be given.
Right, and actually there are natural ways of improving the bacteria, like Dr. Ashwath said, lifestyle management. So if you eat the right kind of food that is probiotic rich, and foods that do not reduce the friendly bacteria, that is important. Then other things that are supposed to improve is just stress management. Increased stress causes dysbiosis. It has been connected. And sleeping properly, sleeping like these days people have this habit of not sleeping enough, sleeping at odd hours. So all that can impact the microbiome.
To understand a small thing, I will tell you. See, whenever, because when you have hear about a drug, we say that this is a probiotic, this is a nutraceutical, or this is a prebiotic, this is a symbiotic. See, there is nothing. What a probiotic is that you give friendly bacteria inside. So these are friendly bacteria we are giving. For example, you are drinking yogurt, the lactobacillus goes inside. It's a probiotic. It's a natural probiotic. You understood? Prebiotics are nothing but not bacteria. They are supplements to food to the probiotics. Okay, that is what is called prebiotics. Prebiotics and probiotic together, what is called the symbiotic. You understood this much? Nutraceuticals are something which stands between the food and the drug. Okay, so classical example, natural nutraceuticals, like naturally we said yogurt for probiotic. Natural nutraceuticals are there like turmeric, ginger, and all are natural nutraceuticals. All what you give, capsules of omega fatty acid, vitamins, minerals, all that comes under nutraceuticals. Okay, so these are all basically what we do is that to increase the microbiome. The basic principle behind all these things, as madam told, healthy lifestyle, stress management, everything. This all these things together. What we do is that together helping together. That means probiotics and so healthy lifestyle. We can have natural probiotics like regular yogurt and all. We advise whenever the patient is having olden days itself, without knowing what is probiotic. We used to in children, our grandmother used to say that you have to have yogurt or chas or something when you have diarrhea. Why you just being told?
But
We are
sir,
replenishing.
now with Swiggy and Zomato,
So that is what.
creating awareness among the
That
new
is what-
generation.
So a recent concept is reducing the state of inflammation in the body.
In the body.
So by doing all these things like sleeping better and lifestyle changes, we are trying to reduce the state of inflammation, reducing the number of inflammatory biomarkers in the body, which are actually also the end products of these harmful bacteria and
Previously, what we used to do is that there was a vaginal discharge. What we used to do, we used to give only antibiotics. Say, for example, you give metronidazole or whatever, clindamycin or whatever you used to give only that. Okay. Now we all know the concept of probiotics. Now what we do is that along with treating, we add probiotics to it. So we can have lactobacillus orally or vaginal suppositories are kept. We are going to a stage when we are going to transplant microbiome from a healthy female to a female who has dysbiosis. Okay, this concept arises from the concept of Clostridium difficile. What they did was that this patient having this Clostridium, that pseudomembranous colitis having that, they took the stool from the normal person and capsules were made, and that was given to through a right tube or through a colonoscopy. This was implanted into and it gave excellent result. And it gave, so that is 90% protection was there. So gradually in our health gynae field also, they are planning to have studies are there where they planning to replenish directly. So how microbiome is replaced? 3 ways. You can give probiotics, you can give nutraceuticals, and or you can put, and but along with that, one reason we are discussing all these things, one thing you should be sure that you have to treat the infection. That treatment should be there, along with these supplements should be there. So the future is something entirely different. And nowadays they have gone out of it. If you say with studies which, because I am professor in medical, we do a lot of research and all these things with our ICMR and all. See, we have gone through program nutraceuticals. In our cancer, the oncology department, they do program nutraceuticals. Nutraceuticals are added. This goes into the abdomen. This programmed bacteria goes inside. Microbiomes goes in. They produce cytotoxic drugs. Like that, lactobacillus linked with phenylalanine. So phenylketonuria patients were given this. Like that to decrease the gut inflammation. E. coli was E. coli 1716 or something 15 or some E. coli was tagged, that goes inside that specific site, it will act. So what we use by probiotics or whatever, what was the general industry, that was all we were replenishing the old. Now we are moved to the another level that we are going for targeted. So, and investigations also we are targeting. See, we are finding out, previously we are finding out lactobacillus is defective. Now we are finding out which lactobacillus is effective, where is lost, and specifically you are replacing that. So the technology has changed a lot actually.
While we were talking about vaginal discharges, right? Have you also faced cases where you have had patients who come up to you and they say that I've faced this problem. I went to Google, I went to ChatGPT. They told me this. I took this medicine and now I'm facing this problem. So does that happen very often?
In the new generation, it's very often, and they come to us very late after taking a lot of antifungals, antibiotics, and douches. And that time the case is already, the vaginal epithelium is gone, and very difficult to treat, and they are always complaining that why it is recurring again and again after taking all these treatments.
Actually, they won't convince us it's a physiological discharge. They always think about it's a pathological discharge and they keep on taking all these medications.
So just one question, like when do I know that I have to go consult a doctor? Like when do I know that I have a problem?
They should have other symptomatology like the color of the discharge and the itching and smelling.
Foul smelly discharge.
It's causing recurrent UTIs. Then you have to consult a doctor.
Thing when treating and it's recurring and it is not. So the people who go from one doctor to another, doctor to another, that are the classical patients. When you add microbiome to it, a supplement to it, get some relief. So when it is not relief, whatever you do, just by giving antibiotics, everybody would have given, I have given metronidazole, other person would have given medicine like that, it would have gone whole round, it would have gone, and patient would have developed even the resistance to it. So only way is that we have to increase the normal bacteria. So it will counter it's like we are increasing the normal, counter the pathologic bacteria by itself.
A similar situation is often encountered in menopausal women who keep on complaining of recurrent UTIs and getting treated by multiple courses of antibiotics, seeing gynecologists, urologists alike. But again, this is part of a genitourinary menopausal syndrome and also a type of urinary dysbiosis. Because of the decreasing estrogen levels, the good bacteria obviously decline in the vagina and in the urethra, leading to atrophies. So antibiotics sometimes may not be the treatment, and maybe some amount of local estrogen plus vaginal probiotics or sometimes systemic probiotics may help these women.
That is the principle behind. Even see, as madam rightly told, at birth you get the bacteria, but the bacteria is not active at that time. At puberty, when the estrogen comes, only the lactobacillus starts working.
So how, what time does the problem generally start happening?
Problem throughout you have seen. This problem of dysbiosis is from birth to death. There is nothing like, there are certain vulnerable groups. Adolescents are vulnerable group. There as healthy, unhealthy habits, all junk foods, all the things. Then postmenopausal. So adolescent and postmenopausal groups are two groups. But then pregnant woman. See, whenever the immunity status, in different part life, the immunity decreases. Okay. So even in a immune compromised state is pregnancy. Okay. So that is why pregnancy is important. So each sector it has on its own. We cannot say that only it is a part of disease, but more vulnerable groups we ask, it's an adolescent groups due to their habits and pregnant woman and menopausal woman. That is why we discuss like that we discussed. Right?
Right, so also one thing what I wanted to ask is how do we ensure that microbiome related diagnostics and therapies, they reach beyond metro cities? So in metro cities, I'm sure we have great hospitals, but like the awareness that has to reach in tier 2, tier 3 cities, villages.
That is your AI has to see, you have to see when you say it should be whatever test you do, it should be your awareness, it should be affordable. Okay, and as accessible to people. So have, as like Nugent Score, madam correctly told, like have tests like a pregnancy card kit. That is what my advice. Where you put drop of vaginal discharge, 2 lines will come and say that, okay, this patient has dysbiosis. Okay, so very rapid test, point of care, rapid test, cheaper test. Okay, it should be rapid, it should
We
be
don't
cheaper.
have such tests.
No, we don't have. See, it's all developing actually. So nowadays, whatever this is, all these tests which we, these are all based on gene tests. Almost most of the things are very costly unless and not like our Nuken score. So whatever we want to do, so we have to bring down it, and the most important is awareness campaign. That can be to like media that you have times now, like media we have, like any media as well as the internet, social media, everything. We create the awareness that most of the people don't know in villages that there is something called a microbiome. Even I know students passing out of doctors, young doctors, many people don't know what is microbiome is. They don't the importance, even if they know one word, they have studied for an essay in microbiology exam, they don't know the importance of microbiome.
I can say that after the session, I'll know quite a lot of things about it. Doctor, if you could tell us.
So the concept has to start right from the schools, like educating them through schools, telling them what is a normal vaginal discharge, what is an abnormal vaginal discharge, because young girls sometimes are obsessed with certain aspects, growing up of their reproductive life. Also teaching women about safe genital and sexual practices. Like I think it shouldn't have been a big deal, but discussing with young girls in the clinic, it does seem that douching, using cleansers inside the vagina, and all these concepts need to be taught in the school, as we have started telling them about menstrual hygiene products. Also the concept of safe sexual practices, again, which will disrupt your vaginal microbiome. Then, as madam said, there are natural probiotics. So the concept of probiotic through science and nutrition in our school textbooks, like curd would be a good supplement, because as you said, if we want to reach the last man in the queue, we may not be able to provide them with pharmaceuticals and those expensive tests, but whatever we can take from our diet, all those things need to be taught right from our school days.
Right, doctor.
Yeah, in US and all, they are doing these tests from home, test your gut, like that. Though they fecal matter, they put in some test tube and they send to the lab and directly for $100 and all.
So the test can happen from home itself.
Yeah.
I mean, there are tests, but they are costly. That is the only thing.
Yeah.
Tests are there. Everything is very costly. See, to a country like India, to when you take only don't take Delhi, metro cities like Delhi. So when you go to the periphery, majority of the population in the periphery. So there, how this test can become affordable? That is our question.
So it's the 3 A's: awareness, affordability, and accessibility. These 3 things are important.
And treatment is much cheaper than the test here.
That is what. So instead of taking a metronidazole tablet for 5 days, it becomes more cheaper than doing a test. Not
It is
only
in thousands of the rupees.
even probiotics are much costlier than the tablet. So the pharmaceutical companies has to take care to bring down the cost of probiotics, and it should be par with the test, at least par or better, to bring it down so that people will easily take the probiotics.
So we mentioned about reducing stress. We mentioned about not using cleansers. What else should women avoid? Just to be safe. Like out there, people who don't know much about it. What should they avoid? What should they do to just be safe from all this?
I think nutrition plays a very big role. So what are the ones that should be totally avoided? Sugar, alcohol, then processed foods which they call genetically modified or antibiotic treated, vegetables that are grown in antibiotic treated soils. So those kind of things. And what are the foods that must be had? Fermented foods are very good. Yogurt, and there are certain vegetables that are really good to take. So anything else that you
I
can
think
add?
green leafy vegetables, fruits,
Yeah.
all this milk, egg, all this fatty,
Bananas are very good. Bananas are
fatty foods please avoid. So and healthy habits, exercise. So two things which have to be again and again from the childhood days itself. Nowadays for parents it's very easy to order from Swiggy and Zomato, and when they that is, and the children, once you have the habit, children likes that only. So to avoid that things from the childhood itself, kind of and awareness to the children that, oh, these are all bad things that will affect you in the future. That is what only we can.
Gut health is the main key. Gut health is the main key to avoid vaginal dysbiosis and microbiome.
Even to
Because
that extent,
menstrual hygiene is very important because that can really cause dysbiosis.
So if you could, we'll ask statements from each one of you because we'll be wrapping up very, very soon. So like we'll just start. Last few words about it.
Well, microbiomes are, it's a most important thing in our health, and we should be aware of how to keep it on a positive level, and lifestyle changes are very important, lifestyle management, and of course the nutraceuticals are important too, to help, because these days modern diets may not be able to include all the things that are healthy, so to supplement that and be very, very careful about taking antibiotics. Injudicious intake of antibiotics can really mess up our systems and lead to so many problems which can be serious, like autoimmune diseases and other problems as well. Yeah.
mine is just healthy habits, exercise, and creating an awareness around, and to whenever you feel that it has to be added to it, never be reluctant to add probiotics and nutraceuticals unless they are not doing any. Say always my principle is that nothing which does not do any harm, nothing taking that. That is my principle.
My only key is awareness among the underprivileged, because these tests they do not reach them. I work in a I should say less privileged area. My nursing home is there, and I see it so difficult to convince them for even a high vaginal swab because they cannot afford it. So affordability is one of the main keys, and I think pharmaceutical companies and the government should look into it, because otherwise we are going to have a lot of dysbiosis and a lot of cancer
Metabolic
patients in the
syndromes.
future.
So I would suggest like anemia Mukta Bharat and all, we have to screen the people of vulnerable age groups for all these dysbiosis, and along with iron, folic acid and all in PCOS diabetes screening, thyroid screening, we have to put this dysbiosis also fact and screen for all these tests, and I advise to take this probiotic rich foods, as well as these Amul like thing, Amul milk and all, they can add on these probiotics to their products, and those we can take it from the market itself directly.
So I would be reiterating what everybody else has already said. Awareness is the key. We all need to be aware that a microbiome exists in all our bodies, and it may just be the key to solving a lot of unraveled mysteries in medical science. And also, we shouldn't mess with the good bacteria in the body by injudicious use of antibiotics. It goes for the people, patients, and the doctors as well. Don't mess up with the good bacteria.
Right. Thank you so much to each one of you doctors. Thank you so much. It was a very interesting session. Thank you.